Hello, everybody. There's a few seats up in the front if people in the back want to be able to find a seat here.
Over here.
So thank you both for the introduction. It's a hard act to follow. My name is Julian. I work at the Rhode Island Department of Health, running the asthma program there. I live about a block and a half away from here, so I walked here. Excited to see everyone here, wanting to learn about this. I have a lot of data and information just about asthma in general to share. I know numbers, sometimes you start talking about numbers and people can kind of glaze out. So I'll try to keep it quick and kind of just describe what we have here. A lot of hands went up when people said, you know, family member with asthma. I have asthma myself, so I understand the experience. It is the most common chronic condition in children, so it's a big issue just in general. There are about 8.5% of children around the country have asthma, but in Rhode Island it's almost 11%. So we have much higher rates of asthma than most of the country. We're the 9th highest in the country in Rhode Island. Within Rhode Island, we know that Black and Latino children are more likely to have asthma and more likely, once they have it, to visit the emergency department or be hospitalized for asthma. The emergency department rate for Black children is 3.5 to 4 times higher than white children. For Latino children, it's about 3 times higher than white children. So we know that asthma is very affected by a lot of different things, by socioeconomics, by poverty, by the environment that people live in. So that includes the indoor environment, inside your home, inside schools, and the outdoor environment in terms of the air around us. We know that air pollution from many sources, including from vehicles, especially from trucks, can both cause asthma in the first place, and then for those people who do have asthma, people with asthma are more susceptible to air pollution. So the same exposure to air pollution from someone without asthma compared to someone with asthma, the person with asthma is more likely to have a bad effect from it. We also know that children, whether they have asthma or not, are more likely to be affected by air pollution because they breathe in more air. They're smaller, they're still developing, their lungs are developing, and so air pollution affects children more than it does adults. And then you look at children with asthma, and they are even more affected by the air pollution around them. We did a look at asthma data across the state at the Department of Health. Every year we look at the hospital data to look at every child, you know, the hospital rates in general. Every year Providence has the highest rate of emergency department visits for asthma, higher than the rest of the state, higher than the non-urban areas part of the state. Providence's rate for hospitalizations is about 75% higher than statewide, and the rate for emergency department visits is about 92% higher than it is statewide. So we know that Providence has both the largest number of kids with asthma, the largest number of emergency department visits, and the highest rates when you compare them. And like I said before, there's a lot of factors for that. We also know that it affects low-income families more. When we looked at the children who are going to the hospital for asthma, 71% of them are enrolled in Medicaid. So that's a huge number. That is way more. There's not 71% of kids in the state enrolled in Medicaid, so we know that there's a lot going on with kids who are enrolled in Medicaid, kids who are living in poverty. So we did a look at the Medicaid data. So we worked with Medicaid. We got the Medicaid data set for, you know, including everyone's address across the entire state, to be able to look at, you know, it's not just about, you know, within people who are all kind of shared circumstances enrolled in Medicaid. We were wondering, would we see similar kinds of differences? And we did. We saw that Providence still has much higher rates than other areas around the state. So it's not just about poverty, it's also about race and racism. It's also about the quality of people's environment. We looked at that Medicaid data across the entire state for each census tract. So to really, you know, before that we were just looking at the kind of comparing city to city or city to town. But with this Medicaid data, having individual addresses, we can look at the neighborhood level, we can look at census tracts. And we did an analysis of every single census tract across the entire state to look at the prevalence of asthma, how many people have asthma, what's the rate of asthma, and the emergency department visits and the hospitalizations. When we did that, we found that the census tract with the highest emergency department rate for the entire state for kids who are in Medicaid is the census tract that includes South Providence and Washington Park. So the borders of the census tract, basically, the northern end is where the 195 highway used to be. It's where the pedestrian bridge was put in, all the way south to just south of Thurber's Ave. So basically where this project is being proposed is right inside the southern end of the census tract. It includes all of Allens Ave, it includes all of Eddy Street within that area. It includes I-95, I-195, and there's a lot going on in that area. It's the highest overall burden of asthma, so in every rate we looked at, it was in the highest quintile, in the highest 20% basically. So it was first for emergency department visits, it was 16th for asthma prevalence out of all of 240 or something in the state. So 18% of the kids in that area do have asthma. It was 7th highest for inpatient hospitalization. So we know that there's a lot going on with it. It's not possible to connect that to any one specific thing, to say it's all because of the highway, it's all because of this project, it's all because of that facility. It's a cumulative impact of all of it. But we know that it's related to the environment. We know that it needs to be addressed. It is a major public health issue, and it needs to be addressed in many different ways. So we need to be finding ways to improve the environment in that area, not make it worse. So with that, I'll pause if there's any questions about that, and I can share any information about it, email it, or share it with people afterwards.
I was reading a magazine that was talking about different cities, and I found out that we are, in terms of communities, we are one of the most polluted in the state and the most polluted in all New England. Is that true? The numbers show that this community is the most polluted. And I wonder if we could go for the EPA guidelines. They are not following, I believe, the EPA guidelines. It may be something that we as neighbors could, behind our council, get legal advice and go for pressuring the city to follow with federal guidelines, because this is just ridiculous. When a community gets into that point, that's going to devalue the properties. And besides, destroy your health of your family. And I was shocked when I see this, oh my God.
That is true. There are other communities that are also polluted too. But there's a good tool. The EPA has a tool called EJ Screen to look at environmental justice issues. That is the kind of combination of the people who live there and the environment around them. And if you look at that tool, there are a number of different environmental factors I look at. So it's not across the board for all of them, but on things like traffic or how close we are to hazardous waste, or how close we are to chemical facilities that are high risk. We are up there in the 95th, 96th, 99th percentile compared to the rest of the state, the rest of the region, the rest of the country. So it's a common experience for many communities, environmental justice communities around the country and around the region, but we are up there in this neighborhood with it. This is outside of the asthma world, but I think in terms of whether we fit with the guidelines, there are, at the federal level, the EPA guidelines, most things kind of look at one piece at a time. And a lot of times it's up to a state or up to a city to be able to create guidelines that look at the total picture, look at the cumulative impact. So not just one facility at a time or one piece of that at a time, but really look at the overall impact and be able to make decisions based on that. And we don't have those policies in place at the state or the city. And there's not, the federal guidelines are kind of the bare minimum, and there's much more we can do beyond that.
Good question. So, are you aware of the role that Rhode Island Hospital is playing in this community? Because if these people have asthma, and I have asthma myself, the reason why I was able to get medication was because I qualified for state-funded healthcare. So, I'm trying to understand, if everyone has asthma, and Rhode Island Hospital isn't paying their share dues on their property taxes,
Yeah.
are they then contributing to this community by providing the resources that they need? So I'm asking you, is there a pipeline that exists, or is they're not doing shit?
There is,
You're treating the
there's
kids.
a little bit separate things. Yeah, there is, so our program works closely with Rhode Island Hospital and Hasbro especially in terms of having programs to provide care to people who have severe asthma. So asthma, in-home asthma visits, providing supplies, education, things like that. It's a separate thing from what you were saying in terms of their role as a nonprofit and a non-taxable entity, and there is regulations around kind of hospital community benefits and the need for them to provide some benefit to the community in different ways, and there's a whole process around how they decide what that looks like. But that is a really important issue, and it is a big issue for sure.
Sorry to interrupt you. So somebody in the Department of Health, do you see it as something that's possible? Because it's necessary.
That's outside my, I'm sorry, I can't really say much about that. I'm not involved in
The
that kind of
biggest
stuff, but I know it is an issue.
that the hospitals are having are shifting the population, the poor population, south by tearing down most of the part of South Providence that used to be housing for low-income people working in all the mill buildings that go up and down South Providence and are empty now. So the reason why Washington Park now has the highest concentration of asthma is because all the people were shifted out of the neighborhood when Rhode Island Hospital bought all that land and turned everything into a parking lot, so that their employees from East Greenwich can park for nothing.
Right.
And you're subsidizing it,
Uh-huh.
because they don't pay tax.
You're here.
But they're huge polluters. They're the second highest polluter in Providence. Because there's a mini city inside Rhode Island Hospital, so they pollute tons. Them and Manchester Power Plant is the second highest polluters in our city.
Thank you, Julian. Thanks, everyone.